Let me tell you something about Penn. Penn is like a candy store because you can go to any school you want and find a person to work with.
Well, universities and schools really exist for society. We always think community and we always think about our relationship to society.
We can better engage city officials in learning how to take research that's conducted by places like Penn and translate that into real effective policy changes.
Children need multidisciplinary professionals working together with them. Without that approach, no single professional can make a difference.
Sometimes you make a difference at the end of the day because you moved one child from harm's way into a safe harbor. Sometimes you know you've succeeded because a class has graduated from school better prepared to go on to higher education than they would have been without Penn's involvement.
I think it's important for our alums and those who care about us to realize just how deeply engaged Penn is in improving the lives of young children, particularly in our own community, but also more broadly through our research and scholarship.
Without partnership and collaboration, we're not able to produce the healthcare providers of the future who understand that a child needs education, needs a family, needs a network, and needs their health and their ability to take care of themselves.
We really, for the first time, made a difference in West Philadelphia. We impacted a community, reduced the crime rate, introduced a new school, staffed the new school, became involved in the health and community issues in West Philadelphia. Now that's a pretty small area. But what we've learned in West Philadelphia, I think, is going to become a template for dealing with urban social issues in cities writ large, in Philadelphia, New York, Chicago, Atlanta.
Social work and educators and nursing have similar missions, missions that come from a strong service perspective as well as a comprehensive and holistic perspective. And when we sit down together, we immediately find common ground.
The three schools, social work, education, and nursing, are distinctive in an important way, which is that we have lots of students actively involved and engaged in community practice settings. Many of the faculty are involved in community practice settings. So we're not just doing the traditional classroom education, we're out there reaching people, we're involved in programs, and indeed we're involved in designing new programs, looking at new policies and ways that the system and government can be better organized to improve the quality of young people's lives.
Each school wears a set of trifocals. It really learns from the immediate experiences that are occurring in its own backyard, which is certainly the experience in the School of Social Work. It generalizes from those local experiences to the national reality and then sees the connection and has the willingness to act on those issues at the international level.
We've been working for the past 4 years, maybe even 5 years now. The School of Social Work, the School of Law, the School of Nursing, the School of Education, to do some collaborative work around children's issues. The project that I'm most involved with is the Field Center for Children's Policy and Practice. And we come together every week to talk about either clinical cases where very tough decisions are being made about the custody of children, to talk about policy issues, to talk about court cases, and we bring our particular knowledge and theoretical framework to the issues. And every time we come out with something that's better than if any of us had done it individually.
When you work with families and you're trying to get them into early school situations, and you're trying to get them appropriate housing so they're not living in homeless shelters, it is an interdisciplinary group work. So we actually have a school readiness specialist right here and a social worker. If your child is not succeeding in school, we have to worry about it. And the fastest way by far is by school.
School bus.
Yes. We have a fabulous Reach Out and Read program. Every single child who walks out of here from a well visit gets a book.
Penn GSE is taking the lead in this community school work.
but it has partners from all over the university, not only in students who, through work study or volunteerism, have a presence in tutoring in the schools, but also through the Psych and Ed program right here at GSE, or through a school liaison that we have on our team. And so we're really trying to really make this a large community effort.
I have 3 NIH grants now focusing on parent-child communication around health issues, particularly around HIV and AIDS and abstinence. Some in church settings, some in clinical settings, and some in various community settings and housing development settings. And so we're very pleased that parents are on board, they are excited, and so I think that any program that wants to have an impact on children must include parents.
There are policymakers all over this country at the federal level, at the state level, that are making decisions that need to be informed by the best knowledge and research that we have, and by an understanding of the people who are impacted by that. And I think we can do it in the school and through our collaborations.
One of the projects that we're working on right now involves faculty from nursing and from education and from social work. What we're doing is we're working with the City of Philadelphia once again to look at the data they have from the school district, from the Child Welfare Agency, from the Homelessness Agency, and from the public health programs to see if there are particular kids who are vulnerable and who are in multiple systems, and in some cases being served by 3 or 4 case managers, and looking for ways to improve services for those kids.
We're serving as a model with respect to universities assisting public schools, certainly in the development of this wonderful school, the Penn Alexander School. We have become kind of experts on developing a wonderful school in the context of a multifaceted neighborhood initiative that worked on economic and commercial development and housing as well as education in a coordinated way.
This school will succeed as a university-assisted school to the extent that it connects with the core mission of the university, with its teaching, research, and outreach missions. Our relationships with departments across Penn grow every year, and we'd like to see those relationships develop into long-term supportive ones where students and faculty see a place at Penn Alexander for them to carry out that core teaching, research, and outreach mission.
The metaphor that I would look to sort of describe where Penn is on the starting blocks, ready to break out into either a 100-yard dash or a marathon, to take what we have accomplished and bring it into the community.
But the bottom line, my coach always told me that the most important thing in the race is not how fast you run, it's how smooth you pass the baton. If you pass that baton smoothly, that person behind you can get it and run and lead the way. They will lead and take off and be what you want them to be. Our job is to be a smooth baton passer and help our children be leaders of tomorrow.